I mean, we've always been pushing for an induction treatment. I'm talking about frontline treatment of the Philadelphia positive ALL. We've always been adopting in the last 15 to 18 years an induction treatment without systemic chemotherapy, based only on the use of a tyrosine kinase inhibitor together with steroids. So that means that you have to identify the Philadelphia chromosome or the B-cell Rabelson within 1 week from diagnosis when the patients get a 1 week steroid-free phase. In the last study that we published in the New England Journal of Hematology about a year and a half ago, we reported the result of one TKI, Dasatinib, so targeted treatment followed by immunotherapy with a bispecific monoclonal antibody. And that was associated with very good responses. Virtually all patients went into remission and a high proportion of molecular responses. We also documented an immune activation induced by the monoclonal antibody Blinatumomab in patients, something that had not been reported before. Now here at the Congress, and you'll hear more from Sabina Chiaretti tomorrow, and if you go to the oral tomorrow, you will hear it. There'll be the update projected 4 years, and without telling you now, the data are remaining extremely positive for the Philadelphia positive ALL. Adding, I think it's very important that this is not only for other patients with no upper age limit. It's not the usual 60, 65, we treated 70-year-olds, 75, 80-year-olds. So this is a major change, and I think we can happily say that with a longer follow-up, the data look very good. While I'm talking, tomorrow we'll also present the data on the Philadelphia negative ALL frontline, where again Blinatumomab is playing a key role because this is incorporated with chemotherapy. These are Philadelphia negative. And Renato Basang is the the first author, and he'll present the data tomorrow, again from the GIMEMA study, and the data looking very promising in terms of response and of minimal residual disease response. So this is important. In prospect, it opens a way to probably reducing the amounts of chemotherapy in the future, adding this monoclonal antibody.